In the serology for early Lyme disease, you will only get a positive blood test in 20 to 50% of the cases, and serology may remain negative if you give antibiotic treatment early in the course. So diagnosis is clinical at this stage early on. We therefore need to change the CDC and the UCALB criteria. The UCALB criteria was established in Europe several years ago. The IDSA and the European Concerted Action on Lyme Borreliosis have recommended this two-tiered testing approach. And according to these guidelines, an immunoblot is not to be performed if the ELISA is negative, despite the fact that there is poor sensitivity of the ELISA tests, which range from 34 to 70.5%. The effect of this is if you use the UCALB criteria and the CDC criteria, you will miss roughly half of the people with Lyme disease in Belgium and in Europe. And I have 3 scientific references below that show you that the sensitivity of this testing is inadequate to pick up Lyme disease. You're going to miss it anywhere between 30 to 60% of the time using the two-tiered criteria. It's very important to understand, when you do send off a test for Lyme disease, what are the Borrelia-specific bands on a Western blot? In other words, how do you know, looking at the tests, that someone really has been exposed to Lyme disease? Well, there are several proteins or bands on a Western blot that tells you that someone has been exposed to Borrelia burgdorferi, the agent of Lyme disease. These are the 23 band, the outer surface protein C, the 31 band, the outer surface protein A, the 34 band, the outer surface protein B, the 39 band, and the 8393 KDA bands. And this was published by Ma et al. On significance of the bands on the Western blot. So if a patient comes to you with the proper clinical symptoms, they tell you that they have good days and bad days. Their muscle pain and joint pain migrates around the body. Their nerve pain, their tingling, numbness, and burning moves around the body. They have memory and concentration problems where their B12 levels and their folic acid levels and their thyroids are normal. And you've screened them for all other diseases, and you can't find a reason why they're tired, why they have muscle and joint pain, why their memory's not working, why they're not falling asleep. And you've done a Western blot, and any one of these bands shows up positive, that would imply that they've been exposed to Borrelia burgdorferi, because the only way they could get these bands on a Western blot is exposure to Lyme disease.